Thank you, Madam Chair, and thank you to Ms. LaBelle for sharing where the White House is going to be focusing on these issues. You've already heard that Washington State has been hit hard by this opioid epidemic. For over a decade, our state has lost about 700 people per year from overdoses, mostly from opioids. And sadly, we saw a 40% increase in mortality due to opioid use in 2020. So we know fentanyl in particular has become an increasingly dangerous threat in my state, and as we've heard across the country. In 2019, 3 students in my district died because the oxycodone that they thought they were taking, which is bad enough already, was laced with fentanyl. And 2 were students in the high school just down the street from my house. Then 2 days ago, in a conversation with another parent, I heard about a bring your own pill party, where a group of high school seniors in my town all brought whatever pills they had to a party, Ritalin, Adderall, oxycodone, Vicodin, whatever, dumped it in a bowl like M&Ms, and then helped themselves without even knowing what they were taking. And this is barely 1 year after the 2 deaths that I just mentioned. So Ms. Liddell, you mentioned in your testimony that one of your strategies to mitigate drug abuse and death is to support evidence-based prevention efforts to reduce youth substance abuse. And as a pediatrician, I know how important it is for pediatricians to talk with their patients and parents to talk with their children. I wondered if you could just talk briefly about the most effective ways to prevent these risky behaviors from starting and then these tragedies.
Thank you very much, Congresswoman, for asking that important question. I want to raise one issue about the press pill issue that you raised. I think all of us need to be aware that this is a trend. CDC has sent alerts about these press pills. That's a lot of what we're seeing. This is pure fentanyl, and people have no idea what they're getting. And this is why the administration has put out the fentanyl test strips, so people who can test what it is that they're getting. I'm not talking about that for youth use, but that's important for to prevent overdose deaths. So for youth use, the National Institute on Drug Abuse has some great tools. SAMHSA, I'm a parent myself. I probably drive my son crazy by talking to him about these issues so much because he has a genetic predisposition to this. So you have to, SAMHSA has a You Talk, They Listen, which is a great tool. And actually, University of Washington has some great prevention programs. And one of the preeminent prevention researchers in the country is there. We can't think that kids won't listen. Certainly they're going to roll their eyes, but they'll listen to you when you talk to them. The other piece that we want to do on prevention is preventing adverse childhood experiences that lead to risky behavior, and that includes substance use. So that's an area that we'll be working more with the Centers for Disease Control and Prevention on, particularly with our drug-free community coalitions.
I really appreciate you bringing all those things up. Can I ask just a quick follow-up question on the fentanyl test strips? Are the pills, do they contain fentanyl only on the outside or throughout? I mean, is this something where you have to crush a pill to test strip it, or can you just rub it on the outside of a pill?
You wet the test strip and you can rub it on the outside of the pill. Again, they're various forms of this, but in many cases it's pure fentanyl.
Okay, it's devastating. Thank you. Also, with the limited time I have left, one of the barriers to care that we've all talked about is simply not having enough access to providers who are trained and confident in treating substance abuse disorder. In particular, most pediatricians have no experience with medically assisted treatment. And I was wondering what ONDCP's role is in ensuring that there's a broad provider network that's adequately trained, and where pediatricians might fall in that plan.
So the Pediatrician Association actually encourages, as you're probably aware, screening for all of their patients. So we want to work with them again on expanding that work.
And screening is standard. Treatment, not so much. Pretty intensive appointments. Do pediatricians generally get the special training?
No, they don't. So we'll be happy to work with you on that issue.
Thank you. I yield back.